as we know that the heart, which is the pumping machine which controls the circulation of the body, it has different sounds. So, how many sounds of heart? Question number 1 is, name the different heart sounds. So, there are 4 heart sounds. Now, these are named as first, second, third and fourth. Okay. So, why the sounds are produced? So, what are the causes of production of heart sounds? First of all, the first sound. The causes of first sound are vascular. So, what are the causes of the sounds? Causes of heart sounds. So, the first heart sound. So, the causes, number 1, vascular. That is, due to turbulence created in the blood by the ventricular contraction. Basically, the flow of blood in the blood vessels are streamlined, and when it is anyhow restricted, then it becomes turbulent. So, the first cause is vascular cause. So, the turbulence created in the blood by the ventricular contraction. So, regarding this, first cause is vascular. B is muscular. What is that? So, due to vibration in the walls of the contracting ventricles. So, this is another cause. So, muscle, that is the cardiac muscle of the ventricles, and due to the vibration in the walls, there is a first heart sound. And another cause is valvular. Okay, that is vibration of the valve cusps during closure of AV valves. So, AV valves are present in between auricle and ventricle. So, the causes of the first heart sound is vascular, muscular and valvular. Okay. Now, moving to question 2, that when is the first sound heard? So, it is heard during the closure of the AV valves at the onset of the ventricular systole. So, the answer is during closure. Okay. And when the atrioventricular valves closes at the so when the ventricles trying to contract, at this onset there is production of first heart sound. Okay. So, what is the significance of this normal first heart sound? The first heart sound signifies the onset of systole, that is ventricular systole, normal AV valve closure and normal ventricular contraction. So, it signifies Okay. So there are certain conditions when the first heart sound becomes louder. So when we go for exercise and if we have hypertension, then this sound become a bit louder. So there are some conditions also where this first heart sound diminished. So it occurred in obesity. Sometimes in obese people we cannot identify the first heart sound. In pericardial effusion, emphysema. So these are some conditions where the first heart sound. So in the causes of second heart sound, again there are vascular and muscular and valvular cause. So vascular, due vibration of the blood column in the aorta and in the pulmonary trunk. So this is the cause. Vibration of the blood column in the aorta and pulmonary trunk. Moving to the muscular cause. So in the muscular cause, the vibration of the walls of ascending aorta and pulmonary trunk. Okay, and in the valvular cause, due to closure of semilunar valve. So the semilunar valve, which is located at the base of aorta and pulmonary artery, so these valves closes, and that's why there is a production of second heart sound. So when is the second heart sound? So this is another question. When it occur? So it heard during closure of semilunar valve at the end of clinical systole. So when we get it during closure of semilunar valve. Okay. Okay. So semilunar valves are basically also known as aortic valve and pulmonary valves. The components of the second sound are the aortic and the pulmonary. These are heard best in the aortic and pulmonary area. Okay, and what is the significance? So the significance is it signifies end of clinical systole and also normal closure of semilunar valves. There are some conditions when the second heart sound becomes louder. So in pulmonary and systemic hypertension, in subjects with thin chest wall, sometimes this second heart sound becomes louder. And there are also some conditions when the second heart sound diminishes. So in aortic incompetence, in aortic stenosis, pulmonary stenosis. So these are some conditions when we cannot find out the second heart sound. Okay. Next question. Why pulse is felt during auscultation of the heart. So this is one important question. The carotid pulse helps to identify the first sound, which almost coincides with it. So that's why. Okay. Now, how is the carotid pulse palpated? It should be palpated very much gently to avoid stimulation of the baroreceptors in the carotid sinus, and the two carotid arteries should never be palpated simultaneously. It is felt in the carotid triangle by the tips of the examining fingers placed medial to the medial border to the sternomastoid muscle. Okay. So, moving to the next question. Another important question, that how we can differentiate between first and second sound. The first sound is of longer duration. So, longer duration means what? It is of 0.15 second, okay, and is of low pitch. So the pitch is also low. What is that? This is 25 to 45 hertz. Okay, and it is heard like the word lub. Right? So the duration of the first sound is, then the pitch, and it sounds like lub. Okay, and it coincides with the carotid pulsation. What about the second sound? Is of shorter duration. So it is of longer duration, and for the second sound it is of shorter duration, and it will be 0.12 second, and high pitched 50 hertz. It is heard like the word dup. Okay, and is produced after the first sound, that is after carotid pulsation. So this is the differentiation between these two. Another sound is murmur. So what is murmur? Murmur actually the sounds produced in heart due to abnormal turbulence in blood flow. So it is basically due to the turbulence in blood flow. And moving to the third and fourth sound. So when is the third sound heard? The third sound is heard sometimes in a normal individual with thin chest and high venous return. So it is also heard in heart failure and in other abnormal situations. So what do you know about fourth sound? Then it is heard just before the first sound and only in abnormal conditions. So today we have gone through these different basic questions regarding the heart sounds. So if you have any query and question, you can ask or can comment in the comment box, and do visit our channel and subscribe. Okay, thank you so much.